The last part of GIT, pharmacology, we will gonna discuss about this prokinetic drugs first. Then we will gonna discuss about the diarrhea and then the constipation. So the prokinetic drugs, mainly in these we are talking about the D2 blockers, which because in exam these are asked. Okay, so number one is metoclopramide, the metoclopramide, and number two is domperidone. These are D2 blockers. The metoclopramide is used for gastroparesis. It can be used for GERD also, and can be used for post-operative ileus also. Okay, and but the problem is that this metoclopramide, it can cross our blood-brain barrier, and because of that there can be extrapyramidal symptom as a side effect, or there can be increase in prolactinemia, means prolactin level increase in the blood. Okay, so and one more thing is like domperidone. In the domperidone is basically used in anti-emetic drug, as an anti-emetic drugs. And for some people who don't know what exactly this GERD is, so GERD is a reflex. Okay, for example, this is our esophagus and this is our stomach. So from stomach some acid are refluxing here. Okay, so that's why we are saying is gastro means stomach, esophagus, reflux disease. Okay, so certain changes are happening in the lining of this lower esophagus, and in case of GERD. Okay, let's not go into too much detail, this is just for pharmacology purpose, just for understanding. Okay, then we are talking about the diarrhea. So in case of diarrhea, in diarrhea we use opioids. Yeah, in diarrhea we use opioid. Now one drawback with opioid is that it can be addicted. Okay, so for that we use the difenoxylate. We use difenoxylate plus atropine. Yeah, means we use both these two together, so for avoiding the addiction. Okay, and another drug can be used, like for example another drug is loperamide. Loperamide is a opioid in which like it is not addictive, it is non-addictive, so we can easily prescribe it to the patient. And basically this loperamide is a drug of choice in case of non-secretory diarrhea. The non-secretory diarrhea, for example, in case of the inflammatory bowel disease or syndrome, like in case of Crohn's disease, or in case of like ulcerative colitis. So in such case, if there is diarrhea, we are going to use the loperamide. Then another point is that the opioids are contraindicated in infective diarrhea. We should remember, if the diarrhea is due to certain infection, like any infection, then we should not prescribe the opioid because it is contraindicated. Okay, then another one like another antidiarrheal is like octreotide. Okay, this basically this octreotide is a drug of choice for secretory diarrhea, like if the patient has, for example, the carcinoid syndrome. Okay, or if the patient is suffering from vipoma. Okay, and the patient is having diarrhea, so then we are going to use the octreotide. Okay, and this octreotide is basically a somatostatin analog. It is a somatostatin analog, so no need to remember that. Just remember the octreotide is used for the diarrhea in case of carcinoid tumor or the vipoma. And one another drug, that is the clonidine. The clonidine is used for chronic diarrhea with diabetes, like if the patient is diabetic. Okay, and the patient is diabetic and there is chronic diarrhea in certain patient with diabetic, then we are gonna use clonidine. Okay, now the next topic is our constipation. So in case of constipation, we are gonna use four types of medicine. Like number one is our bulk forming medicine. Okay, number two is our osmotic agents. Number three is our like certain surfactant. Okay, not that surfactant which are used for lungs, not that one. These surfactant are basically stool softener. Okay, and the fourth one is the stimulants. Okay, so for example, the bulk forming, they can be like dietary fibers. Okay, dietary fibers, or they can be like brain and they can be like methyl cellulose. Okay, they can be like psyllium or like metamucil. Okay, then osmotic agents can be osmotic agents are further categorized into two types. Let's talk about this, like osmotic agents. Okay, this osmotic agent, it can be either the 1 minute. Yeah, so it can be either saline laxatives, or it can be either the non-digestible sugar which are not digested. Okay, hence helping in relieving the constipation, like sugar for example lactulose. Okay, or like for example mannitol, or like for example sorbitol. Okay, these are, or like polyethylene glycol. Okay, then in the saline laxatives, for example like magnesium citrate. Okay, then for example like MgSO4, and another one like sodium phosphate, etc. Now third category of the constipation drug is our surfactant. So basically there can be, for example, docusate sodium, or we can use calcium also, we can use mineral oils also. Okay, then we can use liquid perforin also. So these all can also be used for relieving the constipation. Lastly, there can be like stimulants, for example senna, by the name of senna it came. Then we can use castor oil also. Then we can use like sodium picosulfate also. Okay, then we can use like bisacodyl also, etc. Okay, so basically this is all about the GIT.